Link TV, connecting you to the world. Link TV is viewer supported. Watch more at linktv.org.
Now, TR, you traveled around the world looking at healthcare systems. Let's say that you had a chronic disease, say diabetes. Which country would you want to be a citizen of?
Hey, I'd like to be an American because I have money, I have very good insurance, I'm going to get great care in America. I'm not the problem. The problem is people who lose their jobs or people who can't get any insurance at all in our country. Tens of millions of them don't get care. If I didn't have a job, if I weren't sure about my insurance, lots of other countries provide care for everybody. It would work fine. I mean, my country lived overseas and got the health care, let's see, in Japan was marvelous, no waiting, great care, very low prices. In Britain, sometimes we had to wait a while, but there's no bill in Britain. You know, health care, you pay for it in taxes, but it's free when you show up at the doctor's office. So I'd get good care in all those countries. The problem is not me. I'm doing fine. The problem is the tens of millions of Americans that we leave outside the door. And as I point out in my book, no other rich country does that. All the other rich countries have decided that just like everybody gets to vote and everybody gets to go to school and everybody gets the right to a fair jury and a fair judge when they're charged with a crime, all the other countries have decided that health care, too, is something that just ought to be a right of citizenship in a rich society because it's essential to get an equal shot in life. The U.S. is the only country among all the rich countries that hasn't made that commitment. Poor countries don't provide it. They can't afford it, but we could.
Tell us about Nikki White, who appears on page 1 in your book.
Yeah, well, in my book, I set out to figure out how other countries manage to cover everybody and spend half as much as we do. And along the way, it occurred to me, just as an important question is why. Why would a country commit to cover everybody? And the most important lesson I learned going around the world is that healthcare is fundamentally a moral issue. If a country makes the moral commitment to provide healthcare to everybody, then you can get it done. You can do it. And I wrote this book initially, and I got to the moral question in chapter 11. It's the most important question, but I always knew I was getting there. Sent the manuscript in to my editor, and she calls me up and said, "Why did you save the most important point for chapter 11? Yeah, that's a good point. This is why writers need editors, Wendy. And so we took part of that story and I put it on the front page of the book. This is a 32-year-old college graduate, hardworking, decent person, not a smoker, not a drinker, not fat, just a decent woman in America who contracted a chronic disease, lupus. Lupus is a serious disease, but it's one that modern medicine knows how to treat. People with lupus, on average, live a normal lifespan, 70, 80 years. But poor Nikki White, once she got sick, she couldn't get insurance in the United States. She was too rich to go on Medicaid. She had too much money to get health care through the welfare system, but she had too little money to pay for the drugs and doctors she needed. And at 32 years old, this American woman died. She died of a chronic disease. And as I say in my book, if Nikki White had lived in any other rich country, she'd be alive today because they would treat her. But the United States lets people like that die, the richest country in the world. She belongs on the front page of my book because that's the fundamental question. Do we want to be a country that lets 32-year-old people die because they happen to contract a disease? Or do we want to be a country like all the other rich industrialized democracies that treat people when they get sick?
Well, TR, you make the case in your book that there will be many Nikki Whites in the future if we don't dismantle a for-profit insurance system. How do we move our insurance system from for-profit to non-profit?
Yeah, members of Congress asked me that question. How are we going to get our insurance companies to give up their profits? The interesting point about this is health insurance in America was nonprofit for the first 60 years of its life. This is a product that was invented in the 1930s or so. And both Blue Cross and Blue Shields, they were nonprofit until the 1980s when big companies like WellPoint and United Health and Aetna started buying up the state Blue Shields and turning them into for-profit companies. And once they did that, things really got bad, because if you want to make a profit selling health insurance, well, there are a few simple rules to follow. First, don't sell a policy to anybody who's ever been sick. That's the pre-existing condition. Then they hired hundreds of thousands of underwriters to go through and stamp no on people's claims. I bet you everybody watching this show has had a claim denied at one time or another by the health insurance companies. They do that to save money. It's for profit. They mess up your budget so that they can make more money. That's how they make their money, by denying claims. No other rich country lets that happen. Many countries have private insurance, but they're regulated. They have to cover everybody. They have to pay every claim. Get this, in many countries, if the health insurance company doesn't pay your claim within 5 days, next month's premium is free. They have to pay you fast. Anybody watching this show have that deal? Nobody's got that deal in America.
We need that in this country,
look,
for
private
sure.
health insurance can work. Yeah, my argue in the book, look, private health insurance can work. It doesn't have to be big government, single payer. That works too. Private insurance works, but you've got to regulate those companies.
Link TV is the only U.S. network dedicated to global and national news, uncompromising documentaries, and diverse cultural programs. Programs which connect you to the world. To learn more, visit linktv.org.